called for the introduction of a 6-point plan aimed at claims at protecting the community from the threat of AIDS, the acquired immunity deficiency syndrome. The festival has called on the Minister for Health, Laurie Brereton, to take the following steps. First, the cancellation of Gay Week and next Saturday's homosexual march in Parramatta. Then the closing of all gay bars, discos, bathhouses and saunas until further notice. The transfer of practising homosexual teachers out of the classroom to follow duties which don't involve personal contact with pupils. The Festival of Light wants a total ban on practising homosexuals from donating to blood transfusion services, and another total ban on their travelling to or from Australia, especially to or from the United States. Well, the director of the Festival of Light, Fred Nile, claims that these measures are a must in fighting one of modern society's most serious health dangers. Homosexuals also, of course, recognise the health danger and have already tried to introduce a voluntary health check diary system to beat the disease. But will they cop the festival's unprecedented restrictions? Well, with me now in the studio is Paul Dextor, a leading figure in the gay army, and we have also been joined on the phone by the Reverend Fred Nile. Well, thank you, gentlemen, both for joining us. Mr. Dextor, in the interest of community health, would you accept these restrictions?
Well, I think that Reverend Nile has come up with something very similar to what Hitler proposed before the last war. There's no question about it that this is a gross infringement on human rights, especially gay human rights.
But savage though they may be, would you accept those restrictions if they curtailed the spread of AIDS?
And frankly, they won't curtail the spread of AIDS.
Why not?
Well, there's no way that these restrictions can curtail the spread of AIDS. For a beginning, we don't know what the infectious agent is. We do believe it's sexually transmitted. The law at the current time forbids homosexual acts between homosexual men, and the proposal simply cannot work.
Well, Reverend Nile, why pick on the gay community when medical research shows that AIDS is not solely linked to homosexual activity? Reverend Nile, are you there? We seem to have a little problem with Reverend Nile. We'll try and get him back. But to come back to you, Mr. Dextor, what has been the impact of AIDS on the homosexual community?
Well, obviously, many homosexual men are very afraid of what has obviously become a major threat to their health, and they recognise, as do I, that this is probably the prelude to the same type of reaction amongst the population at large. And most of the men that I have spoken to, and I have been spending a lot of time with the gay community, going around to bars and discos every night I do that, they are all being, as far as I can make out, very responsible. They realise that this is a dangerous situation, and they are being very circumspect.
A dangerous situation in terms of community backlash?
No, well, frankly, I doubt that. I think Reverend Nile's approach to this is an attempt to spark a community backlash, but that would be, in my opinion, totally counterproductive. We in the gay community can more or less handle the situation. We are certainly taking action, much more comprehensive action that Fred Nile has proposed.
Well, Reverend Nile is on the phone now. Reverend, I'm sorry we missed you the first time, but I'll come back to my first question to you. Why pick on the gay community when medical research shows that AIDS is not solely linked to homosexual activity?
The majority of the cases are certainly linked with practising homosexuals, and where there appears to be cases involving, as we've had recently in the United States, AIDS kills a grandmother, AIDS affecting children, it seems as if the link there is with blood transfusions, and so it seems as if the AIDS can be transferred by a blood transfusion, and according to the homosexuals themselves, and they just issued a supplement in the campaign newspaper which indicates, they say, strong evidence indicates that AIDS is transmitted by direct contact with the bodily fluids of a person who is infectious, the most common way in which bodily fluids, semen, saliva, urine, blood, and even stool are exchanged through intimate sexual contact.
But the Health Commission has already taken action as far as blood transfusions are concerned. You want to take it a great deal further in the terms of restriction of travel.
Well,
isn't that almost verging on the vindictive?
When you say the Health Commission's taken action, they haven't really taken action at all. They've simply asked practising homosexuals not to come forward, and I'm taking it to a point of clarity to say that they must not be allowed to give blood transfusions, even if there's a practising homosexual who wants to continue. We have no guarantee at the moment that practising homosexuals are not making donations of blood right at this very moment we're talking.
But can I come back to the point of travel, Reverend Nile?
The cases in Australia, already at least one, it's proved that that person did travel to the United States and returned back to Australia, and that's how they think the disease was brought back here. So I'm saying, in the interest of the health of the homosexuals in Australia, in their own interests, they should support some type of travel ban that it may, we hope it may be too late, that it may prevent the epidemic breaking out here in Australia as it is in America, where there's a tremendous death rate, and there's parades through America now in memory of the deaths of many, many homosexuals.
Well, Mr. Dextor, do you accept those points?
Well, obviously not. The best way to prevent this disease is to get as much public education about it as is humanly possible.
And to try to reduce the possible causes of it. And it seems that homosexual acts are a direct link, according to the homosexual literature that I have, which is put out by the organisation in San Francisco, Guidelines for AIDS Risk Reduction, and it simply says if you want to reduce the risks, you have to reduce the homosexual practices in which we have been...
Reverend Nile, if I may interrupt you, there are now people from the moral majority in America presenting themselves at AIDS clinic with this disease, and the moral majority leader over there has been making ridiculous statements that this is a gay plague, which I note you've got on your media release, and frankly...
That's how the media have described it.
Well, you describe it that way also in your media release, which I find extremely ridiculous.
Well, I think it helps to clarify what we're talking about.
It doesn't clarify it, Reverend Nile, it does not clarify it when your own followers in America, or your comparable followers, are presenting with a disease. Why call it a gay plague? Would you say that we should have a ban on churches in America now that religious people are getting this disease?
It shows that the disease is spreading. It may even be spread through food handling. It may be spread through physical contact. Even the Westmead technicians at the hospital are concerned they may contract the disease through testing the blood.
So why attack gays? Why attack our community, which is being extremely responsible and which is doing a great deal of work to prevent the spread of this disease? And your comments here are very, very harmful to that program.
Well, I'm saying let's go back to the source, and it seems all the evidence is pointing at the source. The origin of it is in the homosexual community.
Sorry, the evidence does not support you there, Reverend Nile. The source of this disease is not known.
Yes, it is known.
I'm sorry, what is known is that homosexual men seem to be susceptible to it. But then we also know that the rest of the community is capable of catching it, and in fact it may be very widespread in the rest of the community.
And that's why I believe in the Festival of Light, and other community leaders and members of the community have a right to propose suggestions that might restrict the spread of the disease.
Well, gentlemen, I wonder if I can butt in on the discussion there. We'll have to bring it to a close fairly shortly. But Reverend Nile, to what extent are you using, in effect, a community scare to achieve your aim and the Festival of Light's aims to ban homosexual activity altogether or get rid of it?
Well, in the beginning, when we first objected to the spread of homosexual publicity and promotion in this state, we indicated one of our main concerns was disease, was the spread of disease. This has always been known. In fact, it's always been present. AIDS is, you might say, a more vicious version of the disease that most practicing homosexuals are afflicted with.
Well, Reverend Nile, why don't you help us fight the disease instead of fighting people?
Gentlemen, I think that's where we'll have to leave it. It is a question which you could both go on answering in quite a long way. With me in the studio has been Paul Dextor, a leading figure in the gay army, and of course on the telephone we had the Reverend Fred Nile from the Festival of Light. Thank you both very much indeed. It's 12 minutes to 1 on the 12:30 report.